Yeah, universal health coverage is perhaps one of the most important public health principles in the past decade. When we think about the concept of universal health coverage, in fact, it's quite profound. The idea that everyone has a right to accessing healthcare. In its principle, it seems very straightforward, but it really is a revolutionary concept in public health. Now we have the concept. As you know, the government's committed across the world to achieve universal health coverage as part of the Sustainable Development Goals. We've defined it now as a political commitment. What does that mean? How do we actually implement it in countries? And achieving universal health coverage is a very challenging undertaking for governments. Universal health coverage, we effectively mean ensuring that everyone has access to care with financial protection, and that care should be quality. Unfortunately, the current situation in cancer is there are massive gaps in the availability of services. There's also major gaps in financial protection, people paying large amounts out of pocket. So our role as a cancer community is how can we help governments achieve universal health coverage by ensuring the largest number of population percentage can reach care and that there is financial protection. Cancer care in general, there's a perception that it's expensive. In reality, it can be. We know, looking at particularly high-income countries, the cost of cancer care can be quite substantial. Cancer care does not have to be expensive or costly either to the government or to patients. So one of the first points of reference is to start with the assumption that cancer doesn't have to be expensive. Once we can get that recognition, we start to look at what is the country's budget and what is the country's set of priorities. That really is one of the most important aspects of universal health coverage, setting priorities and then financing those priorities to ensure that people who need to access services for those interventions can do so without having to pay out of pocket in a substantial amount. It's a very important and challenging question. The timescale, it's difficult to say with certainty. In terms of progress, as a cancer community, we're starting with the important exercise of identifying what are core priorities. So the term that we use is best buys as an example. What are the set of interventions that are cost effective, that are feasible, and that can be attained in most countries? So those interventions we consider the focus of governments. So one of the first important interventions we're recommending is HPV vaccination. We have evidence that it's one of the most cost effective cancer prevention or control interventions. So HPV vaccination is slowly being increased and incorporated into national plans, but to date still isn't being prioritized in a sufficient way. That's one intervention. We also look at cervical cancer screening as another very cost-effective intervention, a best buy. But also, critically, governments are starting to understand that the diagnosis of cancer, particularly early stage cancer, and treatment using a basic package of services is also cost-effective. And the reason this is so important is to help governments understand that a basic cancer package, access to essential medicines, access to critical diagnostics, and treatment can be done in a cost-effective way for countries at all income levels. And it should be stated very clearly that palliative care we consider part of a basic package of services. Where are we now? Admittedly, there are major gaps in services, but because we've defined those interventions, it's given us as a community, the public health community in cancer, an opportunity to tell governments, let's start by focusing on this. Once we've integrated those services, we can build up and start expanding into a larger set of interventions. It's important in two ways. Meetings like this are useful because there is no one-size-fits-all with universal health coverage. We learn different experiences from different countries. For example, in some countries we see that focusing on certain cancers is a good entry point for universal health coverage. We see countries that focus on childhood cancer to start up and then use childhood cancer to prove that cancer services can be value for money, cost-effective, and achievable. From there, we see them expand. In other countries, we see situations in which they start by paying a certain amount for cancer services and then slowly increase the amount of financial protection that they use to ensure that patients have access to care. So situations like this, we learn from countries and we ask them, what are you doing? What are you promoting? What are the interventions that you're focusing on? And similarly, from our side, we can go back to stakeholders and say, as a community, let's focus on these 2 or 3 new elements together. For example, at the WHO, we're focusing now on cervical cancer because this is a very unique moment in time for the concept of the elimination of cervical cancer as a public health problem. Really another opportunity for us to say, within the universal health coverage agenda, with all the activities we want to focus on, let's start with cervical cancer as an important entry point, and another important one being childhood cancer, a disease of great inequities and injustice, both of them. So when we look at how governments spend money, we see that there are some inefficiencies. For example, we see governments spending money on screening, breast cancer screening, when there's no pathology available to make the confirmatory diagnosis, or targeted therapies when there's not a pathologist to say who's eligible for that particular therapy. So working with governments to understand how resources are allocated and how they can be done in an efficient way is really an important opportunity for us in the universal health coverage discussion, which is how can we ensure that what is available in cancer is applied to the population as effectively and as efficiently as possible, and that financial protection is ensured. We do think it's possible. The numbers of people who are suffering financial catastrophe from cancer is really a travesty. You have a diagnosis of cancer, all of the stigma that comes with it, difficulties accessing care, and then the challenges of having to pay out of pocket, selling home, selling possessions. This really is a moral call for us in the public health community to act now. So within the universal health coverage agenda, using efficiencies, telling governments, let's start just by ensuring that we protect patients for core services really is a rallying cry for us in the cancer community.